of Morganton, North Carolina. Tonight, we will hear testimonies from 22 campus workers from across 7 of the UNC systems, universities, including NC State University, UNC Chapel Hill, UNC Central, Winston-Salem State, University of North Carolina, Charlotte, UNC Wilmington, Western Carolina, and Eastern Carolina University. The UNC board governs and the administrators at these facilities have done nothing to hear the systematic input from our frontline essential campus workers amid this COVID-19 disaster. In fact, they have done everything to ignore our voices or consider our lives. Campus workers are disproportionately Black and Latinx. The deaths due to COVID-19 have been disproportionately Black and Latinx workers, mostly due to the exposure we get at work or traveling to work, such as riding the public transit. This is another reflection of the institutional racism deep in the bones of the UNC system and the broader society. To this we say, safe jobs save lives. Black lives matter, Latinx lives matter. Hundreds of students across the state will be returning to campus in a few weeks, and the universities have no real plan to keep the students or our community safe. In fact, a return to campus in this moment, when they're still seeing high records of daily hospitalization of the COVID-19 across the state, it is impossible to do this in a safe manner. As many of you may heard, there have been dozens of cases of football players at the state universities to test positive week before last. These football players live in dorms that are cleaned by our campus housekeepers and are kept up by our maintenance workers. Just last week, we heard at least 6 of our housekeepers at UNC Chapel Hill and 2 at NC Central tested positive for COVID. Again, the universities would rather prioritize making money off the football and sports programs than protecting the lives of our workers and students. They'd rather make money off of selling rent to the dorms than keeping workers safe and students safe. There has been much written about the dramatic hotspots that will likely flare up by creating large gatherings such as classroom settings. Yet, they have no clear written plan in place for not when, but when the outbreak happens on campus. We recognize that the only solution to this disaster is to organize, to build workers' power, to build student power, to unite in a new, powerful coalition that organizations of campus workers, professors, students, and communities to raise up our fists and say, enough is enough. Safe jobs save lives. This town hall is a glimmer of what the coalition could look like. We thank the NC chapter of the American Association of the University Professors for helping us to co-organize this forum, along with student groups that have supported our organizing efforts and who are speaking out tonight. We also want to acknowledge the presence of some of our elected officials from the General Assembly that are listening tonight. We know that the State General Assembly has serious work to do to make the necessary appropriations so that the necessary safety measures can be taken and that workers can still get paid when the universities close. We welcome the representatives Pricey Harrison from Guilford County, then from Wake County, the representatives Cynthia Bell, Rosa Gill, and Julia Von Hafen. Then from Charlotte, Mecklenburg County, Representatives John Autry, Christy Clark, and Representative Verla Ensko from Orange County, along with the State Senator Mike Woodard from Durham. Our testimonies from our workers tonight are organized into 4 broad themes that represent our demands for the UNC system and at each university. These themes are: keep us safe, keep our job and our income safe, end institutional racism, and give UE 150 and AAUP a seat at the table to ensure these safety measures are put into place properly. While we are raising up our demands with the chancellor at each university and representative facility directors and deans, we must acknowledge that ultimately the responsibility falls on Randy Ramsey, the chair of the UNC System Board of Governors, and the conservative majority of the BOG. They, especially Ramsey and other are the ones in authority over the system, over the system-wide initiative to reopen the face-to-face classes and abuse employees and etc. In our strategy, therefore, Ramsey and the other BOG members are appropriate targets because they hold ultimate power for our purposes. Of course, the reactionary Republicans in power and in the state and general assembly also consist of also behind this initiative by the BOG to reopen the UNC system, just as if consists of bars, restaurants, and gyms, etc. For these reactionaries, the UNC system is supposed to earn its own way by increasing tuition and fees, be more like business-like, thus allow corporate taxes and progressive-based NC state income taxes to be seriously cut, as they have been while tuition has gone up for more than 80% over the last decade. No matter that thousands of people may be infected, made seriously ill, and quite a few die, this whole shift over to stage agencies being required to earn revenue by changes fees instead of being tax revenue funded occurred a few years back after the Republicans took power in the state assembly in 2010. Tonight we send a message straight to them.
Yes.
We will now welcome our first speaker.
Por favor, danos el bienvenido a nuestro primer orador o presentador.
And I'd just like to also remind everyone that are just joining, if you need this Zoom conference translated, please click the icon, the globe icon in the bottom of your screen for translation and choose a language. So we have our first speaker up, Ms. Jeremy Alston. She's a UE 150 member and a housekeeper at UNC Chapel Hill.
Hi, everybody. I'm here because I have concerns. I'm one of the workers that work in Parker where the football players was, and my concerns is that we don't have enough equipment, to protect us. Y'all give us a face mask and gloves. That's not going to help nothing. Like, the students are coming back. We barely can keep our mask on, so what makes you think they're going to keep their mask on? And for the football players, we want to know is how long did y'all know that they had the COVID before we even found out anything? And now y'all want to start the testing, but if you want to get tested, you have to go to your own doctor for you to get tested. And I have kids to go home to. So it's like I'm putting my life on the line for them, and y'all not giving us back nothing in return. Y'all don't want to pay anyone. And if you come on, if you get hired within the 5 years, you are considered an emergency worker and you still don't get the benefits. So what's the point of putting my life on the line if y'all not giving anything in return? And then we bring y'all the concerns and y'all say y'all want to fix it. Nothing happens. It gets swept under the rug. Then you got the workers scared to complain because they're scared of what's going to happen to them. So it's like, y'all don't care about us. Y'all just want us to be here to work. Like, how y'all expect us to feel? Like, it's wrong, to be honest. Like, y'all don't care about us, but we here helping y'all out due to this, and we could put our families in jeopardy. It's crazy. So, yeah, something needs to be done one way or the other. Either the students don't come back and we go out, because it's going to be hard. It's a lot of students that go to UNC. So how is y'all going to make it so small for everybody to not come past with each other? Everybody's not going to wear no mask. It's hard to breathe in them things. So how you expect everybody to keep them on their face? Then y'all don't want to give us the right suits to clean or whatever. So it's sad, to be honest. So that's all I have to say.
Thank you, Jeremy.
Welcome.
Next, we have Tracy Harter, a UE 150 member, a housekeeper at UNC Chapel Hill.
I think she's muted.
Tracy, the administrator, unmute her.
Hey, Tracy.
Can you hear me now?
Yes, we can. Thank you.
Okay. I was just saying that what really seriously bothers a lot of us is the lack of transparency. The incident concerning the football players is a perfect example. Before I left my home to come to work, I seen it on the news just beforehand. And when I came into work, as soon as I seen one of the housekeepers that works with Germany, I told her immediately about the incident of football players that tested positive over there, and that I told her, you're not going over there. And I made sure somebody contacted Germany to let her know too. She has children to go home to. And what really is mind-boggling is if it wasn't for the newscast, nobody would have known, because our zone manager didn't know. And when she contacted our assistant director, we could tell by the conversation, he didn't know. So I ended up going over and talking to some of the football players. They were told that it was a low number of players that were tested positive, and they moved them to Old Craig. I think that may be true, because I did some fact checking and found out that the entire zone that Old Craig is in had to go get tested, the whole zone. So what I want to know is, who knew it? When did you know it? And why didn't you tell us? That is the perfect evidence you do not care. Because we had 2 housekeepers over there for God only knows how long before they got moved. That's a perfect example right there. And I've been doing a lot of checking around for what the opening plan is, and just a lot of different information gathering. And so far, there is not anyone, not even the students, are supposed to know when to do what and what they're supposed to do on coming back. They are letting them know bits and pieces that really don't mean anything, like the proper distancing, the normal stuff that we know, and things concerning parking, and when classes first start. They're not even being told anything, even on a week-to-week basis. So our imagination is going to be a lot worse than what maybe reality is. So we seriously need individuals that are knowledgeable and aren't afraid to get in there and fight to be at the table. So we at least know what's going on. When we have to find out from the news and bring it into work to the individuals who it directly affects, we better be at that table. We got to be. How else are we going to know anything? Because you're not telling us. You proved it. Oh, I don't know if I'm muted or unmuted.
No, you're
Can you hear me?
You're
Okay, you
You're
can hear me.
unmuted.
All right. But UNC on every detail, big and small, is playing it extremely close to the vest. And if you have a plan, a workable plan, why not share it? That tells me you don't even know what you're doing and how you're going to do it. And when we ask direct questions, it's always that politician answer where we're working on it. You know, we're taking different things into consideration. Okay, give us the information. Let us know something. My favorite quote by President Obama is, "Nobody has the monopoly on a good idea. Share it with us. We're the ones in the trenches. You're behind the desk. We're the ones that's there and knows what the future problems that we are facing, the situations we are facing, and that concerns us. And so get some feedback from us. Let us let you know, because we're the ones doing it. Who has more knowledge, us or you?" And I guess that's about all I have to say right now.
Thank you, Tracy. So up next, we have our next speaker, Ms. Chiamaka Okonkwo. She's a student leader at Health Care for Justice, UNC Charlotte.
Good evening, everyone. Thank you for the introduction. Can everyone hear me? Yes, lovely. I'm so glad to be here, and I'm so glad to see all the people on this call. This work is so important. I would like to give a thank you to UE Local 150 for putting this together, and to all the workers that are sharing their testimonies tonight. My name is Chiamaka Okonkwo, and I'm a rising fourth-year undergraduate student at the University of North Carolina at Charlotte. I'm speaking as a student worker myself, but I'm also here to amplify the voices of others who are working on the front lines of their institutions, who are not able to provide their services remotely. I have nothing but gratitude for the workers that are playing so many roles on our campuses. And for that reason, it is unfathomable to me why our campus leaders are not doing all that can be done to protect our workers. We demand plans to be released that recognize the concerns and the frustrations that have already been largely ignored by our campus administrators. Why is there such a lack of transparency that, like was just mentioned? Why are there so few plans available to our workers? As a student, I was not even aware that even our workers do not have the information that I was hoping was in some type of confidence, that I was hoping was being released. But obviously this is not the case. The COVID-19 pandemic has already required our campuses to adapt, and we must continue to do so in order to keep our campus workers safe. To do this, we must be hopeful, but also aware that the pandemic has already been catastrophic for so many Black and Latinx lives. Populations on our campuses, some community members are already immunocompromised, have pre-existing health conditions that require utmost care in order to prevent illness. And we also must be aware that these workers have families and livelihoods to protect outside of their jobs and roles on our campus. We cannot let our desire for normalcy precede caution. To create safe campus environments, all UNC system schools must address workers' concerns in a time-effective and meaningful manner. It is imperative that our campuses cater to the needs of workers, providing workplace support, protective equipment, and a permanent platform to continually hear these concerns throughout ever-changing conditions, because it's not going to end just tonight. We need to hear these voices each and every day, because these stories are what matter. Because after all, our workers are essential, but definitely not expendable. Without our campus workers, our institutions, quite frankly, cannot provide any of the services that they are meant to provide. I am asking my fellow students to be vocal, to share these demands, and to use their leadership to ensure that these demands are met. Because as we all know, our universities are places that foster innovation and adaptation and problem solving. And as students, and as administrators, and as community members, it is time to put those skills to work. Save jobs, save lives. Thank you.
I'm sorry. Up next, we have Katie Mack.
Hello. Thank you so much for having me here to speak with you all. My name is Katie Mack. I'm an assistant professor of physics at North Carolina State University. And what I want to talk about is the fact that it really doesn't appear possible to safely carry out a return of students to campus in the situation we're in now. And based on the plans that I've seen from NC State and from other universities in the UNC system, it doesn't appear that the proper care is being taken. And it doesn't appear that the trade-offs are really being openly discussed in terms of what it would take to keep people safe and to carry out instruction in person and bring students to campus and try and have some kind of ordinary college life. We are in a truly unprecedented situation. There's a lot of talk in the media about the fact that other countries have sent students back to schools, but there is nowhere on earth where the pandemic is raging as much as it is here, where people are actually trying to bring students back to schools in the kinds of numbers that we're talking about here. In North Carolina, we're having about 2,000 new cases a day of COVID-19. And as has been already discussed, the pandemic is really very much disproportionately affecting Black and Brown communities. And we need to be aware of that. We need to be aware of the kind of impact that whatever we do on campus is going to have on the community, on the workers in the campus, on students and professors and staff, and everybody who touches the universities in some way. We have a responsibility to the larger community, to everybody involved in our higher education system, to not make this worse. And the way that the plans are being rolled out now, it's unclear what the trade-offs really are. We do obviously want students to have a college experience, to be on campus, but we can't do that at the expense of health and lives of people who are just trying to go to work and just trying to get educations. There are ways to open campuses safely with a massive amount of very frequent testing of all students, with extremely carefully enforced masking policies, with very, very small numbers of people inside rooms, with highly increased ventilation systems, the kinds of measures that would be necessary in a normal situation to open a campus during a pandemic are not the ones being discussed within the system. And given the amount of community spread, bringing people together in person and in large numbers is just not feasible under any reasonable level of protection. So I don't see how it's possible to bring the numbers of people to campus that have been discussed without placing students in danger, without placing faculty in danger, staff, university workers, and our larger communities. And I think that we need to advocate for the health and the lives of everybody in our sphere and make sure that the universities are making responsible plans, being transparent about how much community spread they're expecting to happen, how many students they expect to get sick, how many staff they expect to get sick, what the plans are to care for those who do get sick, what the plans are to shut down if numbers increase in a way that they're not anticipating. none of that has been made clear, and we don't know what the thresholds are. We don't know what the protections are that are in place. We don't know how various financial considerations or other considerations are being balanced. And we deserve to know that, because we are the ones who make this whole system happen. So I think that's all I have to say now. Thank you very much for listening.
Thank you, Katie. Next up, we have Lakeisha Morgan, a UE 150 member, housekeeper at NC State University.
Well, I'm going to say good afternoon, but I'm sorry, but good evening. I had a long speech wrote out, but I'm gonna wing it. I know when we all took our jobs that we all knew and or signed the contract, our application, whatever you want to call it, that we were going to be essential employees. We get that. We understand that. We are not denying that. But there needs to be something in place to protect us. Everyone needs their job. There is, at this point, like I said, everybody needs their job. No one can afford not to get paid. No one can afford not to feed their kids, not to feed their families. But we need to be protected as well as protecting the students, because it's always said for the business need of the university. I get it, I understand it, but the business needs of the university also should mean that we need to keep the students safe as well as the employees. We've got this thing where we was just told that hours was going to change. There's going to be either 2 or 3 different shifts without any compensation. You're going to receive your regular pay. And at some point in time, that is not going to work for everyone, because you have people that have kids. School is finna start back up for those of us who have kids. People take care of parents, people who have underlying health issues. And it's like our needs and or concerns are not being met when it comes to that aspect of our jobs. And it's, oh my God, I'm frustrated, and I'm mad, I'm ticked off, because we ask questions, we don't get answers. We have Spanish speaking and French speaking workers that don't understand what's going on. So after there's a meeting, they have to get with someone for them to explain to them what just happened and or what was said. And I think that's totally wrong. Yes, I get everybody comes here for a change, for a difference, to better themselves. But within that, we have to help each other. I have coworkers that are scared to speak up because of retaliation. I have coworkers who won't say they don't understand because of the fear that is being put into them when it comes to this COVID-19. So we need better communication for everyone when it comes to any and everything that goes on at our universities that we work at. There needs to be some type of initiative taken to where we can get and understand what is going on. There should be no reason for anyone to go into work or get up that morning, turn on the news, and find out that they have cases of the COVID-19 where they work. That's unacceptable. I don't care how you look at it. There's no screening that goes on in the mornings. It's just, I'm gonna take your word that you're fine. I'm gonna take the word that you haven't been anywhere. You don't have a fever. You don't have a cough. Yes, it is accountability when it comes to us, but they need to take the initiative to make sure that we are safe. And I don't see that being done. And hope I covered everything. If I missed anything out, I'm sorry, but I got it all. I winged it because I didn't want to read what I had. I just felt like I needed to speak from my heart.
Well, we thank you, Lakeisha.
Thank you, Miss Zakia.
Up next, we have Crystal Bisk, a housekeeper at UNC Central. Excuse me, a housekeeper at NC Central.
I'm trying to turn on my camera, sorry. Hello, how's everyone doing this evening? A lot of everybody's covered, we've been talking about a lot of the same thing. But working as a housekeeper, being on the front line is just a lot of things that you see every day as an essential worker. Yeah, they want you to be there, they want you to be on time, but a lot of things that they're not doing on their end and their part, and such as masks. We have to buy our own. They're not providing any masks for us. As an essential worker, I need a protective mask. That's part of my job. I think that's something that should be provided for us. Mask is kind of hard to find, disposable ones if you don't want to wear the ones, every day and wash. I think we need gowns. On our campus at NCCU, we've had cases not only from students, from staff. We have a lot of construction going on. A lot of construction workers are coming onto our campuses and in the communities, and they have the virus, and we're not being told at all. And if we do find out, we're finding out from co-workers or, the people that work close with the people that have the COVID. And when we say something, it's like, oh, that's not your place to warn other employees where COVID is. But I feel like it's management job, it's management place to say, hey, if I work in building A and you know that the person that had COVID or may had contact with somebody that had COVID, I should know because that's my building, that's where I work. That's my health you're putting at risk. And if I get COVID and I get sick, that's one less housekeeper you have, or that's 2 or 3 housekeepers less you have to come in and do the job. So I feel like, proper PPE is very essential to frontline workers because this is something that we need to protect ourselves and protect our families. So we're trying to get rid of it. And as you guys see, the numbers just keep rising and rising and rising. Another thing was it was just the communication and not keeping us abreast of things that's going on around the campus, and just keeping information hidden from us. And when we find out, it's like, well, but don't tell anybody else. Or if it is, it's after the fact that the housekeepers and maintenance people have came in contact with this area. So now you're scared and you're freaked out and you have to go get tested because you don't know if they're telling the truth or if they're telling a lie because they're not telling you anything. And then the things that we're asking for as far as like PPE, stuff to do our job, they're saying, oh, there's no budget. It was a budget before COVID. So what happened? Where's the transparency in the budget? What happened to it? It just disappeared when COVID came. I just think that, you know, being an essential worker, we're being more exposed and at risk to the COVID, because they're just keeping a lot of things from us, and they're not being transparency with the things and their policies and procedures. What is the policy when there's COVID on campus? We were told that there were supposed to be hazmat teams from the outside to come in. We haven't seen it because we're the hazmat team. The hazmat team without the proper PPE. So, I mean, a lot of people have, you know, covered a lot, but that was more of my main point of having the proper PPE being on the front line, keeping us safe at work. Thank you.
Thank you, Crystal. Up next, we have Richard Guy, a UE 150 member, a maintenance worker at Winston-Salem State University.
I don't think Richard is on yet. Maybe we can come back to him.
Okay, thank you for that. Moving along, we have Andrew Friedman, a UE 150 member, grad worker at NC State University in the math department.
My video has been stopped by the host. Can it be back on, please?
I should have asked. There you go.
Hi. Thank you so much for having me. I just want to say that we must realize that it is not if people get sick and die when we reopen, but when. There's no acceptable number of dead before we close again. So we know that the proper decision is to go online now. We shouldn't be on campus at all, but graduate students and other workers cannot be called essential and not be given a living wage, not be given proper health insurance, and be given zero hazard pay in an objectively unsafe environment. Furthermore, the living wage in Wake County, where NC State is located, is $27,000 a year, and the minimum graduate student stipend, which hasn't changed since I believe 1999, is only $8,000 a year, with most graduate students making less than $20,000, not even including the $2,600 we pay in student fees after taxes each year to even be allowed to work. All of this is to say that graduate students have always been extremely economically vulnerable, and this crisis has immensely amplified those vulnerabilities. Myself and many others have to weigh their economic welfare with their health on a daily basis, and no one should be forced to make that decision, not ever, but especially during this pandemic. We need to protect students, graduate students, faculty, maintenance staff, cafeteria workers, and all other staff. And the only way to do this is to go online for the fall semester. It's clear we all need to work together in solidarity to put pressure on those who have the power to make these decisions, because the university regents buckle under pressure from their donors who want them to reopen, but instead they need to listen to the pressure from all of us whose lives are on the line from these decisions. This current trajectory that the university system has taken is a complete abdication of the duty that the universities have to minimize administrative costs and maximize benefits to their constituents, as outlined in verbatim in their budget. Thank you.
Thank you, Andrew. Next, we have John Cox, an associate professor in the Department of Global Studies and the director of Center of Holocaust, Genocide, and Human Rights, and president of AAUP at UNC Charlotte.
Okay, thanks. Yeah, thanks everyone. And I guess just to start with, I'll just say a couple of points. I'll just kind of amplify or emphasize that, Sakia, right at the top of the program, you said how the people that run the university system have no real plan and so on. And just take my word for it, that is so true. Because like some of us professors are in email listservs where we can see what they're talking about. Believe me, they have no idea what the hell they're talking about. What the ideas they're cooking up are bizarre, nutty, and very far from reality, et cetera, and completely divorced from any concern for, for staff or workers or even their students and so on. But I'm just going to tell a little story to illustrate a point that I think Lakeisha made a point about. It's really campus workers, housekeeping workers, and maintenance workers have so much, not only know so much more about what the reality is, what's really going on campus, but have so much closer relationships with our students than our administrators ever do. Our universities are run by people who get paid $500,000, who never even step down out of their offices to even, say hi to any students. I saw a chancellor one time talking to a couple of frat boys, and that's the only time I've even seen him, actually mingling with any students or anything. I say, by the way, I can't tell if my voice is coming through or if okay, all right. Okay, just real briefly. Okay, so, on my campus at UNC Charlotte, there was a shooting that took place on April 30th, a year ago. And a couple students were killed. And there was a student who I know very well who was, who was injured and who ran into the, but who ran into the building next door, and a dining services worker helped her out, probably saved her life. Because this dining services worker had some medical training, anyway, this worker who saved her life was laid off from her job last March, when all the Trotwell's workers were laid off back in mid-March. And that probably happened to Carolina too, where it's run by Aramark, which of course has contracts with prisons and whatnot. But anyway, I guess I'm just trying to tell the story real briefly, and I know I'm sorry I'm going up on my 2-minute limit, to illustrate the point that this is just on the one hand, it was a beautiful example of solidarity between the campus workers and our students. This campus worker had been working there for 20 years and then was later laid off. She probably saved the life of the student who was injured in this campus shooting, which then the university quite outrageously exploited the shooting for all sorts of propaganda and for fundraising to talk about Niner Nation and all this kind of crap, while laying off a whole bunch of workers and while forcing housekeeping workers to come into the building the next morning to clean up the building where the shooting had taken place and to come to work at 5 o'clock in the morning and so on. So all these outrageous things happen every day. So I'm sorry, again, I'm going over my limit, but I just wanted to very briefly say that there are so many things that happen on our campuses every day that on the one hand illustrate the outrageousness of the exploitation and of the power structure on our campuses, and of how racism is embedded and all that. But then on the other hand, that illustrate the possibilities of solidarity and of action, because I really believe that, especially in this moment, in the last couple months, I think there are a hell of a lot of students, as well as professors and others, who are not always alert to the, to the interests and concerns and issues related to our campus workers, housekeeping, maintenance, groundskeeping workers, and dining services workers. But I think now this is a great opportunity, in a sense, to to really to build up something.
Thank you. Thank you, John Cox. Up next, we have David Brannigan, a groundskeeper at UNC Chapel Hill.
Good evening, everybody. Hope you can all hear me. My name is David Brannigan. I work at UNC Chapel Hill in the grounds department. I've been there about 16 years. And one of the first things that struck me was that nobody seemed to be paying any attention to the increased vulnerability of our Black housekeepers, the women of color that are predominantly the largest part of the workforce, and our Latino workers and our Asian workers, all of whom are much more vulnerable. The science told us that very early on. But nobody in the administration seemed to even notice that. And so I started raising my own concerns about that. And I've started asking people who have been designated as emergency response COVID workers how it's going on campus currently when there are no students there. And the reports I'm getting back is that there is no hope for compliance, for protection of workers by making people wear masks and observe social distancing. And the fact is, it's not going to work. And if it's not going to work, it's going to kill workers. It may kill students, it may kill faculty. My main concern at the moment is that you are putting the lowest paid workers, on most vulnerable workers, on the front line to try protect the health of white middle class young people. That seems absolutely immoral. And my daughter earlier in the crisis came to me and she said, "Daddy, I've learnt a new word." "Oh, what's that?" She said, "Unprecedented." She said, "You've been using that word a lot." And it's true. This is unprecedented. But the university system, and Chapel Hill, where I pay most attention, is just acting in the same old way. And I would say to the administration that us workers and faculty and staff that are actually trying to show solidarity have to say to you that common and garden stock answers to this crisis will not work. It's unprecedented. But what's the most unprecedented aspect about it is the dereliction of leadership. There is no leadership on our campuses. There is no leadership in our system assembly. There is no leadership from our Chancellor on UNC Chapel Hill campus. That's one of the main things. And one of the main reasons they can get away with this terrible planning, this unrealistic dreamland planning, is because we can't hold them to account as regularly as we would do. And so they're sitting there in their administrative positions on their $150,000 a year jobs, saying to people like housekeepers and groundskeepers and dining hall workers, "Oh, if you can't come to work because of the unprecedented COVID crisis, then we will cut your pay by a third." And then after a little while, said, "We will cut your pay by 2/3. And so you will have to make up out of your vacation or your sick time, which of course you may need in the future, you will have to make up the difference in your wage." So essentially, all the lowest paid, most vulnerable workers in the UNC system are being coerced, economically coerced, back into an unsafe working environment. And that should shame the Chancellor of UNC. When we lost a student body president at UNC Chapel Hill to a horrific murder, nobody had to tell Chancellor Misa to bring the campus together. He did that because he was a leader. And that's what leaders do. They take the lead. And our Chancellor is not taking the lead. And only thing they're paying attention to is the bottom line. And their bottom line is what's most important to them. But we cannot allow their bottom line to mean that some of us are going to flatline and die. It's absolutely immoral, and the leadership crisis is unprecedented. It's unprecedented that you think you can fix this situation and make it safe for middle-class white people by endangering working-class people of color. That is absolutely immoral and unprecedented. What needs to happen is to do some unprecedented things. They're saying that if we don't have the students back, then it will become It's an existential crisis. And it's not an existential crisis. It just means that your bottom line won't be as healthy. But it will mean that some of us will not die. So what we need unprecedented solutions, transparency, and inclusion. That's not what we're getting. I've been asking people on campus. An incident today, I spoke to somebody. They were working at the president's house. A facilities employee walked out, not wearing a mask, chewing tobacco, and just spat their tobacco spit into the bed where these people were working. Now, do you think anybody in the administration chews tobacco? I doubt it very much. But you know what? Amongst us working class people, we know quite a lot of people that chew tobacco. That presents a massive health risk. Do you think that the white administration has even thought of that? Of course not, because the people making the decisions have no input at a granular level from the people that know what is going on and how unrealistic these supposed solutions are. And I think one of the most important things is that if we bring the students back, will the students be disciplined for endangering workers? Or will it just be something, oh, well, they're students. We cannot allow students who feel invulnerable to endanger the low-paid workers. And I think another thing that's really important to ask at this stage, particularly for Chapel Hill, we all heard about the athletics people. I don't know if they were football players, basketball players, but athletes anyway. 37 tested positive, and they've been tested, they've been sent home, they've been to isolate. Have they offered that same support to the housekeepers that have tested positive in Chapel Hill and NC State? No, I got told that they were sent home and told to go and get tested. Did the athletes have to go home and get tested on their dollar? Or did the athletics department, the university, have plenty of funds for that? So that's a question I want answered directly from the Chancellor. Are you supporting the housekeepers that you have made ill by your poor preparation the same way you are supporting the athletes? If not, you should be, or you need to stop supporting athletics, because I think athletics is one of the things that is driving this. The power of the athletic lobby in our university is way too strong. The other thing I would like to know, and I would like to remind us all in solidarity, we heard earlier that there's some elective representatives listening to this webinar. We need to remind them and remind everybody that we will remember these people at the election time. Chapel Hill and the UNC system is too frightened of the right-wingers in Raleigh. That's what's poisoning our approach. They're paying too much attention to people that have political agendas to drive instead of looking at an agenda that serves the needs of our faculty, our staff, our students, and our workers. To do anything less is an absolute abdication of the moral responsibility of leadership that is demanded in the UNC system. And if the Chancellor can't live up to that, he's letting people down and he will have their deaths on his conscience. So I would say, try to work on our solidarity and let's make sure that the elected officials know that we will remember them. That's all I would say at this point. And thank you for your solidarity.
Thank you, David. Up next, we have Elle Perry, a student at Eastern Carolina University and the co-chair of the Young Democratic Socialists of America.
Hi, everyone. Can you hear me? Thanks for letting me be here tonight. I'm gonna, as you said, I'm a student going into my senior year social work major at ECU, and part of YDSA, and I'm just gonna do my best to represent East Carolina University. So, I mean, I pretty much agree with everything everyone already said, and I just feel like for me, what really needs to be.
You are breaking up.
I mean, I remember
we can barely
getting
hear you.
an email where they told us that they were gonna. Oof, I'm sorry.
Elle, we can barely hear
Can you hear me
you.
better now?
Yes, just a little better. Thank you.
Okay. I'm sorry. I'll try to talk loud and be very brief. I just remember getting the email that they were of the very few plans, if you can call it a plan, that they were going to implement, that they were going to switch the semester around and have it end before Thanksgiving. So people didn't go home and like pass the virus. And just when you read that, your first thought is, okay, what about people who are going home every day? So it's just like stuff like that. It's just, it honestly, I just felt so insulted, just like, not just my life, but also they're insulting our intelligence because they, I mean, really just waiting for us to get over the fact that a bunch of people are going to die and get sick and lose their income. Because I feel they're just going to, like, it's not like they're keeping, I'm sorry, can you say?
Yeah, you're
I'm sorry.
breaking up. Yeah.
Am I still audible?
Barely.
Can you still hear me? I'm sorry. Very old computer. But I'll be very brief. So Eastern North Carolina, Greenville is historically a very poor area of our state, and ECU has always marketed itself as being a regional university that kind of gives back to the region. But this has always been true, but this crisis is kind of amplified the fact that it's very much opposite. ECU takes a lot from the surrounding regions, Greenville, Winterville, the surrounding cities, and the workers that live there, and doesn't give anything back. And my computer is very bad, so I'm gonna leave it at that. Thank you for having me here.
Thank you, Elle. And she's having some computer problems, but we thank her for joining us and sharing. Up next, we have Alpha Cravey, a retired associate professor at UNC Chapel Hill in the geography department.
Alpha hasn't logged in.
Okay, thank you, Dante. We're gonna move on to our next speaker, Mo Kessler, a graduate assistant in the School of Arts and Design at Western Carolina University.
Hi, y'all. Thank you for having me. I really appreciate it. And just, huge solidarity to every worker that's spoken thus far. This is just horrible. And I also came with a lot of points, but I think speaking real about where I am, I'm currently just in this grieving process of how epically this system has let us all down. I'm very used to, I've been a community organizer for a long time. I don't fool myself that people put people above profits, but I couldn't imagine the scale in which this system has proven to us how disposable we are in their eyes. And it's heartbreaking every day. And I just want to say, I wanted to get on this call to hear from other folks, but I wanted to also speak to the kind of region that my university's in. Sometimes us rural folks get left off of a lot of conversations because, there's problems with rural areas getting there, internet connection, all of that. But, I wanted to speak to the fact that WCU it's a NC Promise school. So majority of our students are already coming from very economically unstable situations. And we're asking people to put their necks on the line and take on debt in order to be here, and possibly leave best case scenario with medical debt versus leaving in a casket. And it is just so overwhelming, the fact that it's not only my student population, it's not only the worker population, but in a rural community like ours, everybody's job intersects with the university. So we're not just talking about, a system where everybody on campus are the ones that are vulnerable. We're talking about entire multiple townships and cities that are in this area. Everybody comes in contact with this university. And way before this crisis came upon us, our rural healthcare system has been broken and ignored and broken again. And we're overwhelmed when we get the flu that comes through. So the idea that our university doubles, almost triples the population of the local folks around here, and our systems are already crashing that we would need for an epidemic like this, it just guarantees that we're gonna lose lives. And that's been reported. Eric Ginsberg did a great piece on how rural counties like myself, where I live, have a lower number percentage-wise, but we have the highest death rates. And it's because our hospitals were already failing us. Our infrastructure is already failing us. The poverty rates here are too high to deal with something like this. So I just wanted to give a shout out because, I've done the same thing. I've followed the routes. I've sat on the webinars. I've listened to the chancellor speak. I've wrote emails and had them passed up asking, give me facts, give me numbers, give me some percentage, give me something that takes into account the hospital beds that are here, the ventilators that are here, this number of staff that are going to be affected, the number of students you're inviting back on campus. And I have gotten nothing but wait and see, wait for this next one. Oh, come sit on this one. And every time I get to that, oh, these are the people that are going to provide us answers, what happens is we get conversations like this is just something that we're going to have to push through as a community. That it's really on us, to keep each other safe. And that's all we can do at the end of the day. Or some crazy non-scientific answers like herd immunity is going to save us. Or we don't really need to be 6 feet away. We could only do, we could get by with 3. And I just want to name something else and then I'll let time go because I really want to hear from other workers. But I don't know how many people know out there that they're planning to create quarantine dorms. So if you get infected on campus, they're not sending you home. They're not reporting that. They're sticking you in your own dorm and then expecting the same underpaid workers to go and take care of them as if they're going to be protected in some way because of hope and pixie dust. So I just want people to hear that because it sounds unbelievable. And this is actually the only concrete plan that they've given us is we're going to keep them away in a dorm and hope for the best. So like I said, again, thank y'all for having me. My heart goes out to every single one of y'all that are going into work nervous, that are dealing with stuff that we should have never done. And I just want to say none of us are disposable. So who's going to fight for us? Thanks.
Thank you. Before we go on to the next point, did Richard Guy join us? Okay. The next section 2, keep our jobs and income safe. We have Robert Cook, a UE member of recycling at the housekeeping department at UNC Charlotte.
He's trying to join us. He's not here yet. Hopefully he can get on in a minute.
Okay. How about Jeffrey Eady? He is a UE member of housekeeping at NC Central University.
Hello, everybody. How y'all doing? Thank you, Dante, and everyone else that organized this call. I would like to say to everyone that's on the call, thank you. Thank you. You are important. You are appreciated. You are essential. You are courageous. And you're brave for being on this call and going into work every day. God forbid, there's a good chance that if, there's someone that's on this call now may not be on this call next time we're together. So in that, I would like to say, stay safe, stay protected, and continue to protect and take care of one another. With that being said, I'm not going to, go over. You guys made a lot of great points about how the system is showing us what they feel about us. They use words like essential. And essential as an adjective means absolutely necessary. Extremely important. As a noun, it means anything that is absolutely necessary. Is what they tell us. You're essential. We can't do without you. But in each and every way, the current administration and the institution has shown us that we're not very important at all. No plan, no PPE, no tests, the return of students masked or unmasked. And you call us essential workers, but you don't pay us, which is the reason, what I'm going to speak of is that, if we have to be here, if people are going to come put their lives on the line each and every day, and make no mistakes, we've been in this thing since the beginning. We didn't just start coming to work, where faculty and staff were allowed to work from home, where the policemen had limited schedules. We did not. The essential workers, like David said, the people that come that are the most vulnerable, the people that are the least paid, the people that do the most important work for the institution, are the people that are being left behind. And it's really disgraceful. It's shameful. It's hurtful. And it's dangerous at this point. And that's the most thing to me. It's a very dangerous thing. People are losing their lives, and the only care that we have gotten, the only care that's been shown to us, is the care that we've shown to one another through organizing, through talking to each other, through sharing of masks and gloves to those that don't have it, to sharing of information like we're doing now, to take care of each other is the only care that we have. So I'm thankful to the local unions and the organizers and everyone else on this call. You guys stay safe, but we're asking for a compensation. We want to be paid. If we have to be here, if I have to put my life on the line and others have to put their lives on the line, then there needs to be some compensation. You don't call this essential and that we're absolutely necessary without there being a compensation for putting their lives on the line. People want to get paid. People need to be paid if they're going to be here. We have people with COPD, we have people with asthma, people with cancer, people with pre-existing conditions. What accommodations are going to be made for those people? These are the type of things we're asking for. I have a unique experience because I am a student. I'm in my junior year here at NCCU working on my bachelor's in business. And I'm also a worker. I'm on both sides of this thing because my classes start on the 24th. I have 2 online and I have 2 in class. And so I have the unique perspective of being a student as well as a worker. As a student, I want to be here. I want to keep people safe. I want to come to learn. I don't want to do those things if it's going to jeopardize the lives and the health of someone else. As a worker, I feel let down by all of the people that call us essential, all the people that say we need to be here, because we've done our part. Have we not come in since this whole thing began? Have we not been here? Have we not taken upon ourselves to do what is necessary for ourselves while looking and questioning the current administration on what they're doing and recognizing and pointing out their shortcomings? If we have to be here, then protect us, protect the people, protect the students, and make sure that the compensation for them being here is something that is necessary at this point. It's not even something that we're asking for. It's something that is necessary and something that's been overlooked and something for far too long. And I just want to say to you guys, just to continue to stay safe, continue to fight, save workers, save lives. I'm on this thing so that we can get the information out here, because it's not a question, like people say, it's not a question of if it's going to happen. It's a question of when. And I just pray you guys stay safe, and I pray that your loved ones stay safe and stay healthy through all this, because if anything, if we learn anything through this whole crisis from the very beginning, is that the people that are at the highest, the people that are at the top, the people that are the best and the brightest, that get paid the most, the people that we look to for the leadership is not existing. They're not even here. You know, they're not even making the decisions. They're not being leaders. So if that is the case, then here we are. We will lead ourselves to where we need to be. And I'm confident that we can all get there together. And you guys stay safe and you guys keep the fight up, and thank you for your time.
And you as well, Jeffrey. Thank you for that. We have our next section, which is ending institutional racism. And we have Ms. Hannah, a student at UNC Chapel Hill, to talk about it.
Hello, everyone. Can you hear me? Beautiful. All right. Well, hello, everyone. Thank you so much for having me tonight. And thank you to everyone else for sharing your truths and concerns with us all. It really means so much for us to be able to sit here and hear it. And I really hope people are really listening. My name is Hannah Wundemagen, and I'm a rising senior at UNC Chapel Hill. And I want to speak very briefly tonight on behalf of students at UNC. Given the brief amount of time that I have, I'm going to keep this short and address a couple of concerns. Someone earlier, I believe it was David, brought up mask enforcement, and I want to bring up a perspective that is a very real concern that students have, and that is the potential for racially biased punishments for lack of wearing masks or social distancing, and the potential to not be taken care of or taken seriously in the event that students do get sick. I don't know if many people realize what Black and Brown students at UNC, Black and Brown students, faculty, and workers have to deal with at UNC, UNC Chapel Hill specifically. In the 3 years going on 4, I can count on 2 hands and probably need more about the number of times our lives have been at risk on various levels. So now, in addition to having to deal with institutional racism at UNC, and in addition to the fact that the virus already disproportionately affects Black and Brown communities, we have to also prepare for these rules or enforcements to be disproportionately enacted and affecting our lives, and also have the fear of not being prioritized or being taken care of should we get sick. As a Black student myself, I've questioned how enforcement of guidelines and wearing masks is going to happen, and have called for people to be ready to monitor the demographics of who will receive honor code violations and who doesn't, because we've seen the racial bias already even in the honor court in previous violation cases. On top of that, I also know from experience and events on campus which groups, communities, and areas on campus are more targeted and policed, and which groups, communities, and areas on campus are allowed to continue to break the rules without significant consequence. That being said, one group and community that usually isn't punished for their actions and have already shown intentions to not follow social distancing rules are fraternities and sororities. At a Carborough Town Council meeting a few days ago, Provost Bloom was asked about restrictions on Greek organizations on campus. And according to a tweet from Taylor Heaton, who is a reporter from the Daily Tar Heel who was live tweeting the meeting, the provost responded that, quote, the university is restricted in how they can control group activities in Greek organizations because the university does not own that property. And I feel like a comment from one of my friends and another undergraduate student, Eleanor Murray, who commented by a tweet said, this only removes responsibility away from the university and harms everyone, including the community. So take all that to account. And on top of that, a survey was recently conducted that showed that of UNC students that showed that 30% of people said they will still go to parties and large gatherings. So it's already concerning that that is what some students plan on doing, on top of the university refusing to take steps to enforce social distancing rules within Greek life institutions. We can all take the proper measures we need to. Say in a best case scenario, we all take the proper measures, we have the least amount of cases, and so on and so forth. But if you have a population of students who will continue to party and carry out their activities, it's just going to undermine everything that we've been working for and that we're working towards. Greek institutions need to be held accountable at all these institutions, and the universities need to step up or we will all suffer. The university has a history of prioritizing institutions and groups with money, and I'll be frank, white students. We've seen that play out time and time again, from Silent Sam to attempted settlements with white supremacist groups to countless other actions that have proven that the university, UNC specifically, prioritizes legacy, money, and the brand. And I have no doubt that every action that has been taken and will be taken from here on out will be through those lenses. I want to close this up. I do want to express that a significant number of students have expressed their genuine concern for the safety of their peers and for workers and professors, and they plan on abiding by the rules. We've even taken recently to canceling our on-campus housing plans and moving off campus so that we won't put housekeepers at risk as well as other students we live with. However, even that has been met with difficulty, as UNC Housing has not updated the website to reflect changes, making it hard for people to cancel their housing because they think they will be charged significant fees, when in fact it was discovered that people can actually cancel their housings with no fees before July 31st. So the fact that they're not updating the website to show that people can cancel their housings without any fees shows that there is a lack of transparency, and this is adding an extra obstacle for people. This shows this obstacle and lack of transparency with housing is representative of a larger pattern of our university refusing to be transparent with every decision and addressing student, faculty, and community members. In-state students, out-of-state students, international students, we're all trying to make decisions for our health and the well-being of others. But how can we make decisions when UNC isn't giving us much to go off of? Why does it take students on UNC Twitter making noises to be heard? Why does it take us to do the work and digging up the data and information to figure this out? Why are we doing the work for y'all? So in closing, I just wanted to state that I've only brought up a small subset of a larger laundry list of concerns that undergraduate students have about returning on campus, from transportation to class to meal options to food access and more. An undergraduate student, Ankush Vij, created a petition today to demand that universities go remote. And within that petition, you can find other reasons and stats that back up additional student concerns that I've not touched on today. Finally, I hope that administration from each school represented in the UNC school systems are really listening tonight. And I want you to hear this. It's easy to make decisions in your suits and ties in your office and homes where you can retreat during the semester, looking and focusing on the money that you get to pocket. But realize the burden of the next coming weeks and months are falling explicitly on everyone represented on this call today, and many others who aren't represented as well, who will be on the ground and taking the brunt of your policies and decisions. If those people are telling you that they don't feel comfortable and that something is wrong, you need to listen. Universities need to start listening, and I really hope they start tonight. So thank you again for having me tonight. That's all I have to say.
Thank you, Hannah. Our next section deals with us having a seat at the table. Our first speaker, Larry Tucker, a UE 150 member and a maintenance worker at NC Central University.
Good evening, everybody. I'm sitting here flabbergasted because Hannah was just so awesome. I'm like, really? I gotta follow her. I'm Larry Tucker. I'm a maintenance technician at North Carolina Central University. Man, like, it's a lot of people that cover some really, really great points. But Hannah was awesome. Like, that was awesome. So a lot of the things that I had planned on speaking on, people already spoke on. But I'll piggyback off of some of the things that Hannah just ended with. People sitting up in the office making decisions in suits, focusing on the profit of their bottom line. Every relationship that I've ever known, an effective relationship that always had effective and open communication, and every unhealthy relationship that I've ever been aware of has had the lack of effective or open communication. There's no clearer way for a person to tell you that they don't care anything about you than to not hear you out, to be able to speak to you or act as if they really care about how you feel or the effect that something may have on you. At North Carolina Central University, I just speak, we have a lot of Latino employees, and I take it personal that we don't have any bilingual or Hispanic speaking supervisors, Latino speaking supervisors, to be able to communicate with them. How are you going to communicate with them for their needs? Like the young lady said about UNC Chapel Hill, about people speak Spanish and they speak French, and then someone comes up with a rule and a policy, and then they just make you have to adhere to it. And you're like, what did he say? What we got to do? We got to come in at 3 o'clock in the morning. Who's making the decision to say that people got to come in at 3 o'clock in the morning? At what kind of sense does that make? 3 o'clock in the morning, like, who comes up with these shifts? Obviously not someone who works this shift. That's one of the reasons why we definitely need seats at the table. I'm a salaried employee. I've looked up my salary several times. It has a range. The range, let's just pick a number, goes from 35,000 to maybe 60,000. If I'm a salaried employee and I work all year, that's my salary for the year. Then that means that that money is allotted for me to be able to get an increase, cost of living increase, get a raise, get a promotion. All of that is attached to that. What happens to that money? And why all of a sudden, when we need things like personal protective equipment, boots, or that money is not in the budget. The budget's frozen. We need paper, we need ink to go into the printer so that we can continue doing the things we got to do, print out work orders or what have you. There's a freeze right now. There's a freeze on the gas card for us to put gas in our vehicles, but we got those vehicles all year with a gas card and a surplus for us to be able to use it. So I'm just trying to figure out why there isn't any transparency. Piggybacking on the thing with the COVID-19 situation, we've had football players. I do maintenance. I currently got up a building, me and my coworker, within the last 2 days because the COVID guy, the football players that contracted the COVID virus were going to be going in that building, and we had no choice but to finish getting the building up by today. But that's not the first time that that's happened. There was another building where this had happened before. Me and the locksmith were caught up in some on-call situations on the weekend, and it took a week before they notified us. So that's the reason why we feel like each institution in the UNC system needs some representative from the trenches, the hidden figures, if you will, the people who are should be the liaisons and bridging the gaps between conversations between the working class and administrative class. And we need seats at those tables to be able to voice our opinions and our concerns and what's necessary for the working class. But everybody has said some awesome things, so I'm really like at a loss for words. That's all I got to say.
Thank you, Larry. Up next, we have Rex Kearney, a UE 150 member, housekeeper at UNC Charlotte. Is Rex on?
Don't see Rex on, Takia.
Rex is on. I don't know if he's having trouble with his audio. Robert Cook is also back on from UNC Charlotte. I don't know if we want to have Robert Cook talk now.
Absolutely. Robert, are you ready?
Yes, I am. How y'all doing today?
Good.
I just wanted to kind of piggyback on what the gentleman was talking about before, the maintenance guy, and that is trying to be at work at 3 o'clock in the morning. That's ridiculous. That destroys people's lives. They don't think about people who have kids or family or have situations like, well, my wife and I, we just have one vehicle. And so when I accepted the job, it was from 7 to 3:30. And that was the main reason I did it. Now, they sent out an email and asked everybody, what schedule would you prefer? And I told them that wasn't going to work for me at all, that it was a financial burden on me to try to go out all of a sudden and have to buy another car, then to pay for 2 cars to be on campus. I really don't think the administrative people are really looking at what impact this does to other people and to people's family lives. Because if you happen to be there at 3 in the morning, then you got to be in bed by 6 or 7 at night. That's no life. I just don't understand why they're doing this. You have a first, second, and third shift. So why can't they just bump up the second and third shifts while no one is there? They're saying that the reason that they're trying to do this is so that they can get into the classrooms a little early in the morning before the kids get there. But you could do this on third shift as far as getting those classrooms clean and everything else that you need to have done. I think that one of the reasons why they're trying to change this, because I know from a lot of people that I've talked to, they are working like from 5 to 2. They don't get a shift differential from 5 to like 6:30 in the morning. And I don't think that's right. I think they're just trying to sideline having to pay that differential rather than just bumping up second and third shifts. So you can have, most of the classes are over with, I'm going to say about 7 or 8 at night. But really, at 10 at night, nobody is there. So you can have a strong second, third shift to go in and do the job that you need to do. And the main thing that I want to say about it is that the quality of life that they are not looking at, how this really impact people who are married and who have kids. I know some single people probably fall in love with it, but it doesn't work for me. And I just want to thank y'all for your time. Hello?
Thank you, Robert.
You're muted, Sakia. And I don't know if Rex can get audio.
Dante,
Hey,
can you guys hear me out there?
Yes, we can hear you. Rex Kearney?
Yes.
Oh, yes. Okay, thank you.
I would just like to speak briefly and say we would all like to have a seat at the table, but I don't know if that's going to be possible. So I feel that we should weaponize ourselves as employees. We should all go to the doctor, make sure that we're very healthy. If we're in the high risk category, get FMLA. That way they can't ding you for attendance. I really hate to bring that up, but I feel like we don't have much of a choice. Our livelihoods are at stake here. There's going to be massive budget cuts within the next year or two, if we even make it through this semester or this school year. I mean, I'm just very concerned about our job security. So I'm just going to advocate that all high-risk employees go get yourself checked out. If you're able to get FMLA, that can protect you from the attendance policy. That's pretty much all I have to say. Thank you for your time.
Thank you. Up next, we have Pavel Nachowski, a grad worker at UNC Chapel Hill.
Thanks. Good evening, everyone. My name is Pavel Machowski. I'm a graduate worker in philosophy department at UNC Chapel Hill. I wanted to begin by thanking all the comrades who have spoken tonight, to thank UE 150 and AAUP for organizing this town hall, and the interpreters who have made our words accessible to everyone. I also want to thank you at home for listening. The situation we're in is a dire one, but I'm heartened by the fact that I find myself in such good company tonight. There's little I can say to add to what's been said by tonight's speakers, and I'll try not to make any unnecessary repetitions. The fact of the matter, though, is that along with everyone who has spoken here tonight, it's become obvious that there's virtually no information come down from the administration to us, the grad workers, in terms of how the school is reopening and how this is supposed to happen in a way that everyone can be kept safe. Zero. This seems to be pervasive since, as you've seen, faculty members and campus workers are just as worried and puzzled about what will happen as anyone else. And the reason's clear. There is no existing plan that can address the issues we have. What we can confidently say is that the administration committed itself to reopening the school before any of the necessary steps were in place to make sure this happened safely. They did this so they can keep tuition prices high and profit margins wide. Let me be clear. This is a function of the way the political and economic powers have structured the running of the university. And they should, those who are in charge of this, should and will be held accountable. But this doesn't change the fact that it's us, the workers, who are expected to take the risks that this reckless pursuit of profit entails. It is the most vulnerable of our community that are having to figure out how to navigate this crisis. And it's to them that my heart goes out. My heart goes out to all the comrades in student housing, food services, and maintenance who are expected to do the most with the least, with no increases in wages and no adequate safety gear. My heart also goes out to the fellow graduate workers, some of whom still don't consider themselves to be workers because they're bewitched by a false sense of prestige and the allure of the academy. This is an illusion. We work for a living, and that makes us workers. The university simply cannot function without us, just as it can't function without the faculty, the cleaning staff, the food service workers, and the maintenance crews. And my heart also goes out to the students whom we all deeply care for and who are also at risk, whether they realize it or not. Some of whom, as we've seen, do realize it and are very concerned about this. The fact of the matter is that we're all interconnected and mutually dependent in this enterprise called the workplace, the university. There's no scenario in which the faculty can be kept safe while the housekeepers are not. There's no scenario in which the graduate workers can be kept safe while the maintenance workers are not. And there's no scenario in which one of us is safe while the other is not. There is no scenario in which the university as a whole can be safe while our jobs aren't safe. The only solution for this predicament that we're in is for us, the workers, all the way down from the lowest paid employee to the highest paid faculty member, to have a seat at the table in negotiating the plans for reopening. So far, this hasn't happened, and it's a travesty. We have put out several petitions, all of which have been ignored by the university. And I encourage you also to sign the current petition that we have. Hopefully we can put a link to that up. But it will happen. We will get a seat at the table because of the coalition that we're building tonight, because we will make it happen. And I'm confident with that. I want to leave you with this piece of optimism. We can do it. And I'm so very happy that so many people were here tonight to share in this. Thank you once again for the opportunity to speak. And I look forward to the work we're going to do soon.
Good to see you, Pavel, and thank you. Up next, we have Jay Smith, a professor at AAUP at UNC Chapel Hill.
Thank you. Thank you so much for having me. I believe I'm the last scheduled speaker, and I just want to say I feel wholly inadequate to this task of wrapping up this amazing conversation that we've had. It's been so informative and so humbling, and I just thank you all for sharing your testimonies and for being here together. Since I'm a professor of history at UNC Chapel Hill, and I'm also the vice president of the AAUP, and since AAUP is a co-sponsor of tonight's meeting, I thought I would take just a couple of minutes, I hope no more than about 90 seconds actually, to share a couple of defining characteristics of the AAUP. The AAUP has, since its founding in 1915, fought for two things, more or less incessantly: academic freedom on the one hand, and shared university governance on the other hand. And the fact that so many of our administrators in the UNC system have ignored the principles of shared governance has been a source of enormous frustration to members of the AAUP, to faculty all over the system. And I know, having heard from all of you tonight, from students, undergraduates, graduate students, and all campus workers too. And so in light of the current crisis, the AAUP, the National Office of the AAUP, just released a couple of days ago its reaffirmation of an important set of principles that were articulated in 1966 by the American Council on Education, the AAUP, and the Association of Governing Boards of Universities and Colleges. It's crucial to note that governing boards endorsed these principles in 1966, and they entered the bloodstream of American higher education and have been there ever since. They reaffirmed this statement on university governance, which recommends adequate communication and joint planning and effort, commonly referred to as shared governance, among the governing board, administration, faculty, and students, that is, all members of the community. A key portion of this principle is that faculty have primary responsibility for decisions related to academic matters, including all aspects of student life which relate to the educational process. Again, we feel frustrated that so many vital decisions have been made in the last couple of months without adequate faculty participation and the participation of all others who are going to be affected by these decisions. Although this statement that was issued jointly in 1966 recognized that governing boards have the ultimate say in many vital areas, the authority of the governing boards, according to this 1966 statement, should be exercised adversely, that is, contrary to the will of the faculty and the other members of the university community, only in exceptional circumstances and for reasons communicated to the faculty. I could go on. I was going to say, quote a little bit further, but I think I'm probably near the end of my 2 minutes, and we all need to get on with our evenings. But my point here is that the AAUP calls on, with all of you, it calls on university administrations across the state to be more transparent, to be open, to bring us to the table, to have honest conversations about how we should proceed over the next month or so, as they are barreling toward the August 10 opening of classes, at Chapel Hill at least. So we call on you to bring us in to the conversation and to be responsible. And I think I'll end things there. I will note, however, for those of you who are interested, the AAUP is tentatively planning another meeting, another Zoom meeting next week. I will leave here my email for you. Just send me an email if you're interested in details as they develop. I'll leave it in the chat, that is. And just get in touch with me, okay? But thanks to all of you for an amazing night.
Thank you. And our last speaker for the night is Dominique Harris, a UE 150 member and president of our Charlotte chapter and our Medicare for All specialist. Dominique.
Hear me? Yo.
Yeah, we can hear you, Dom.
All right, what's up, everybody? I've been waiting a long time for this, and I ain't gonna barrel through it, but I'm gonna let y'all know. I'm just poor boy that grew up on a road called Poking White, and I end up stumbling on something that most of the world already knows, and that's Medicare for All, or a universal health care plan that provides every citizen in their respective country with health care. Something that we haven't seen to get through our minds, that everybody should have health care as a human right. It isn't something that you should have to earn through going to a job and working and then getting. It isn't something that should be connected to your employer. And in the middle of a pandemic, when we have over 130,000 Americans dead, and we have more Americans getting the virus and having to take out their personal time from work in order to get treatment, with bills that are rising up to the millions, we see now more than ever the need for a universal healthcare system. Whenever COVID-19 came out, it was first, I won't say discovered, but it was first brought to the attention of the World Health Organization in December 2019. We didn't act upon it until March of 2020. That was a great extent of time that our leaders in all levels of government, don't just put it on a Cheeto, put it on everybody in the level of government, because they all fell all the way down to our local leaders and our leaders at work, who weren't really elected to those positions, but they were chose by people that liked them or liked what they stood for. We understand that they didn't know what the hell to do. We didn't know what the hell to do. But instead of inviting us into the rooms for those conversations, instead of them knowing that the people on the front lines understood what we were going into better than anything, because if somebody get the flu at work, if somebody gets the flu at work, we know not to go near that person. That person should have kept their ass at home. So whenever we have a pandemic that has no vaccine, we should have understood at that moment that everybody should have been locked down at the house and everybody should have had the health care provided for. It shouldn't have been one bill given to one person that came out and told us that they would cover the cost of testing. That's nothing, because the treatment is where the real cost lies. I mean, you can have somebody in a hospital get sick just for going to the hospital for something completely unrelated, and then come out after they got cured of COVID, and then go back in the very next week, and all of that cost is put on them. And then when we did shut down, instead of them furloughing employees and then using those funds, those unlimited amounts of money, seeing as we create our own currency, instead of using those funds to provide those businesses with enough money to pay their employees and keep them on the health care, they decided to put them on unemployment, therefore kicking. I might mute that man. All right, thanks. Is therefore kicking hundreds of thousands of people, millions of people off of their health care. See, we already knew it wasn't right. We already knew that was unjust. We already knew that there was no reason for them to do that to us, because we are people and we should be treated as human beings. Human beings deserve the right to live, even if they can't afford the treatment. So I'm just going to throw that on out there. We need Medicare for all. The Southern Workers came up with Southern Workers Assembly came up with a Medicare for all campaign, and we fought for it, and we keep on fighting for it in the face of Joe Biden, in the face of Donald Trump, in the face of any other leader or so-called leader that doesn't respect us as human beings, because that's what the acknowledgement of, whenever they come out their mouth, whenever they fix their lips and say that we can do it a different way, that's them acknowledging that we don't matter as people. So we're advocating for Medicare for all. I encourage everybody in this group to join the Southern Workers Assembly and fight for Medicare for all, because the only way we're going to get it is if we stand together.
Thank you, Dominique. So that concludes our portion of our town hall with our stories. And
can everybody see the slides that I have showing?
Yes, you're good.
Yes. Okay,
Yes.
cool. Hello, everybody. My name is Zofia Knorik. I'm a UE 150 member at UNC Chapel Hill in the grad worker chapter. I'm a worker in the ecology department. So I'm gonna be respectful of everybody's time. We're already a little bit over, so I'm gonna keep this short. But this is a call to action. So our individual campuses and communities are highly diverse, and so too are our needs during this public health crisis and unprecedented social uprising. Through the grassroots organization of workers across the UNC system, several common themes have emerged, and we're presenting these themes below as a counter-narrative strategy framework to UNC's messaging. So it's 6 points. 1, not if, but when. I'm not going to read the details of these, but it's on the homepage of our website, workersofunc.org. So there's details to all of these, but I'm just going to run through kind of the bullet points. Number 2, in fact, the time to move courses online is now. Number 3, there's a false trade-off between financial health and public health. Number 4, this situation points to a larger crisis in North Carolina higher education. Number 5, we're all in this together. And number 6, international and undocumented students are especially vulnerable. So something to keep in mind. This framework is intended to be comprehensive, but not exhaustive. exhaustive, excuse me. There's obviously power and solidarity in numbers. So if this framework resonates with you, if the powerful testimony that you've heard from workers resonates with you, please take action tomorrow with us and tell UNC that safe jobs save lives. Let me see if I can advance this here. Maybe, there we go. Okay, so we're branding this tomorrow, July 17th, as a day of action, but it's going to be the first of many days of sustained action until UNC rescinds its short-sighted and catastrophic plans to reopen its 16 campus communities for the fall 2020 semester. We will continue our struggle until we successfully prevent this public disaster. We've been sounding the alarm regarding these plans of our respective campuses for months via numerous petitions, op-eds, even internal campus surveys, but our administrators have yet to listen to us through the written medium. This town hall was a first step in diversifying and escalating our actions to make our voices heard. So the action toolkit that we offer on our website is robust. There are opportunities for all workers, interests, and skill sets. If you're new to organizing, we have email templates, phone transcripts, and links to petitions that you can sign. If you're a seasoned phone banker and you don't get anxiety on the phone like I do, I encourage you to take 5 minutes out of your day to call the administration, call our local officials, our representatives who joined us here tonight. And then if you're ready to march on your campus tomorrow or sometime next week, I know that it's kind of short notice, I encourage you to also take part in that. So at the Chapel Hill campus tomorrow, we're going to meet at 3:30 at the South Building, and we're going to physically deliver our demands to the administration as graduate workers. And then we're going to march down to the Cook, oh goodness, I'm blanking on it now that I don't have it in front of me. The Cheek Clark Building to deliver a hard copy of the campus worker demands. If you didn't get the chance to share a testimony tonight, but are feeling empowered to do so, we encourage you to do so at the share testimony page. We're accepting both named and anonymous submissions from UNC workers. We're going to post a recording of this webinar to our YouTube channel on the Workers of UNC website, and it's also on our Facebook page. We'll post any questions that didn't get answered in our short time together here. So thank you everyone for your solidarity, for your bravery, for your vulnerability. Together we're gonna win, and I really truly believe that. So thank you so much. I hope you're able to join us tomorrow.
Thank you, Zofia. And this concludes our town hall forum. We would like to thank you again for joining us. Thank you to all the speakers that came out and shared their stories. So if anyone doesn't have anything else, take care and have a good night.
Thank you, everybody.
Right on. Organize the South.
Have a good night.
Organize the South.
Safe job, save lives, y'all.
Bye.
Thank you, everyone.
Take care. Bye.
Good job, y'all.
Bye.
Thank you all. Bye.
You guys want to discuss that you should get more or less. The only other question I have with regard to the TV equipment, I found incredible.
Paul, I don't know if you're still on. If you need anything to capture the chat or to capture the
I'm
video?
saving it too.
It should automatically just save to the folder that your recording is saved in.
I also saved the chat, just an FYI, so if there's anything we need to pull from the quotes, we can have those.
Okay, great job, everybody. Thank you, Sakia. You did such an amazing job moderating. I really appreciate all your hard work.
Thank you.
Yeah, thanks.
Hey,